Hi, I'm Rachel Forsyth, Consultant Vascular Surgeon in Edinburgh and Chair of the Circulation Foundation, the UK National Vascular Charity. I'm really happy to bring you this BJS Academy video about the National Abdominal Aortic Aneurysm Screening Programme. In the video, you'll hear from a patient who has been enrolled in the NAASP programme for the last 9 years, and he'll be talking to a specialist nurse and myself about his thoughts and feelings on being part of the programme. And hopefully this will be useful to patients, prospective patients, and also health professionals to get the patient's point of view across. The National Abdominal Aortic Aneurysm Screening Programme invites males aged 65 to come for a quick, non-invasive and painless ultrasound of the abdominal aorta, as this is the group of patients who are at highest risk for abdominal aortic aneurysm formation. Enjoy. In this short video, we're going to talk a little bit about the National Abdominal Aortic Aneurysm Screening Programme. With us, we have a vascular nurse specialist who does the screening for our patients, and he also manages all aspects of the patient journey in patients who have an aneurysm and or going for repair. And we also have one of our patients. So we'll just start with some quick introductions.
Hi, I'm Lorna, I'm a vascular nurse specialist.
Hi, I'm Jim O'Neill. Obviously the patient.
So Jim,
yes.
Tell us a bit about when you found out and how you found out that you have an aneurysm.
Well, I received a letter asking me to go for a scan. Didn't know anything about it. Didn't even know what an aneurysm was, to be honest with you. But I thought I better turn up. I went, got the scan and was told that I had an aneurysm and it was 3.2 centimetres. Then I start asking questions, what is an aneurysm,
Sure.
Where is it, how is it going to affect me, things like that. Mm-hmm. But I think the thing was, there was nothing wrong with me. Do you know what I mean? I was going there, what are they looking for? So that was how it started.
Sure. And had you done any reading before you went? You said you didn't know what an aneurysm was.
Didn't even know what an aneurysm was.
And why did you go to the appointment?
Sorry?
Why did you go to the appointment?
I don't know. Now, normally, I wouldn't. Normally, if I don't know what it is and I think, oh, this is no use, this is not going to do me any good, I wouldn't go. But I did. I think I was encouraged to go.
Mm-hmm. Are you glad you went to find out?
150%.
Okay.
Ever such a number.
Yeah. I'm going to ask Lorna to tell us a bit about what happens, and then we'll come back to you for a bit more information. So Lorna, what happened when Jim came? What do you do as the nurse practitioner in the screening appointment?
So when the participant arrives, I usually just talk through why they're there, what they're there for, because like Jim says, a lot of people have never heard of an aneurysm or even an aorta. So I usually start by explaining what the scan is for and how the scan is done. And then we do the scan, and obviously in Jim's case we did find a small aneurysm, so then we sit down and we talk about what that means for Jim and where we go from there.
And Jim, when you've heard the words, when you were told you had an aneurysm, how did you feel in that moment?
Not very good. Not very good. It's unknown to me, you know what I mean? And you think, as soon as I heard aorta, I thought, oh, here we go, this is not good. But I'm going to be honest with you, over the years, you sort of, don't worry. I don't worry now. Especially in the last 2 years. See, before that I did, see the week that I was due to come for the scan, I used to worry, oh, is it going to be, is it going to be high, is it going, that worried me. And I'm going to be honest with you, I did. Shouldn't have went, I know, but you know how you do go and read up on things, and that scared me. Mm-hmm. That did scare me. I stopped it once I thought I shouldn't be reading this, because you're better just finding out as you go along. I think when I used to go once a year, it was fine, but when they cut it down to 3 months, you think, oh, whatever's going to happen, it's getting near.
And Lorna, why do you change the surveillance intervals? Why did Jim go from 1 year to 3 months?
Yeah, so Jim's aneurysm was small when it was detected, and so we do a yearly scan at that point up until it gets to 4.5 centimetres in diameter. We don't fix aneurysms till they get to 5.5 centimetres. So once it gets to 4.5, we scan closer together, just to keep a closer eye on the aneurysm as it's getting up to that size where we might need to think about fixing it.
Okay. And Jim, you said when you went from those 1 year appointments to 3 months, it made you feel more anxious.
Mm-hmm.
Did you ever get a sense that you were reassured because it was looked at more often?
100%. Yes. Yes.
Yeah. So it's a mix of both emotions.
And the funny thing was, I remember Lorna saying to me, I think it was about a year ago, because it's not been moving rapidly. It's been sitting at the same spot for the last 9 months. And I remember Lorna saying, I don't know what you're doing, but keep doing it. So I go to the gym. I don't particularly like the gym, but I'm going to keep going. I don't know what helps and what doesn't help, but that's what I've been doing, and she told me to keep doing it, so I'm going to keep doing it.
Good. Must do what Lorna says, I do
I
anyway.
must do, yes.
And are there any other things like tablets or anything else that you're told to do when you're diagnosed with an aneurysm?
Anyway, sorry?
Tablets or anything
No.
else?
No.
No tablets. Any tablets Jim's meant to take?
Yeah, I think we probably mentioned to you before about taking a statin.
Oh, aye.
Yes.
Aye, I take statin.
Take statin.
Oh, sorry, I didn't know that's for that.
Forgot what it was for.
It's been that long.
Of course. How long has it been that you've had the scans?
9 years.
9 years.
Quite a long time.
And I've been doing, I think, about the last year and a half. Or maybe
3 months.
3 months.
Yeah.
You know, but it hasn't get any bigger.
Mm-hmm. And at the end, what other advice or tablets would you give a patient if they come and they don't know anything about it and they're diagnosed?
So when aneurysm is detected, we usually have a chat about the lifestyle. We talk about smoking. We talk about exercise and weight, and I usually ask if there were any mutations already, and then advise them to go along to the GP and have a chat about statins and an aspirin as usual.
And what did you think about taking new tablets as well? You know, you had all this information, you got a new diagnosis of having an aneurysm, we're telling you to take some tablets. How do you feel about all that?
Take them. I just take them. In fact, you know, I remember my brother saying to me once, Jim, when you get into hospital, they're not doing things to annoy you. They're there to help you, so just do what you're told. You know, so I do what I'm told.
Good. And where in the journey could we do things differently or better? Because you said you went into this, you got a letter in the post, you had no idea what it was, and you didn't Google it or look it up. You went to the appointment open-minded, but without any information. As a patient, do you think having information at the start when you get the letter would be good? Or do you think it's fine just to kind of turn up and deal with it?
Do you know, I've been thinking about that because I know people that received the letter and never went. Now, my brother received his letter and he said, this is the way he talks, see that aneurysm thing you've got, I have to go, but I don't think I'm going to bother. And I thought, no, I'm going to be honest with you. See, with his lifestyle, I've put money on him having an aneurysm, you know, 60 cigarettes a day and still doing it. No, he's fine. He went and he was told, I'm not to go back. I went, well, I'm telling you, there's guys at the gym. That was another thing. I don't know how you would catch them because they've never received a letter, but they've moved about a lot.
And what age are those guys?
One is 76. The other one is 84. So I don't know if that's maybe it has started.
How long has the screening programme been in Scotland?
So I think about 13 years now, 12,
exactly.
13 years.
So he'll have missed it.
So the older gentleman will have missed out,
missed
but can refer himself if he still wants a
You
scan.
know,
That's a possibility.
that's what Big Eric, the fella that came to says, and he keeps coming to me because he'll say, you going for that aneurysm thing? I've still never had a letter. I said, well, I would go and see my doctor then. and ask them.
Tell us more, Lorna. So tell us a bit about that. If someone hasn't had a screening scan but they're over 65, what would you advise them?
So they can self-refer. They just contact the screening office or look on NHS Inform. That will give you a number to call, and they can call up. They can check whether, because some people have been scanned and they've forgotten. It's a very quick scan, like you say. A lot of people don't know what it's for in the first place. You know, and they're getting older as well, so it may be that they've actually had it done and they just don't remember. That does often happen. So they can phone the screening office. The office will check whether they've been invited, whether they've been scanned before, and if they haven't, they can absolutely come in and have a scan. Even if they've been before and they don't remember the result, or they feel like they haven't been scanned, we're happy to do it again. It's a harmless scan. It's quite quick. It's quite simple. So yeah, I would always encourage anyone just to phone up and check.
And I understand. The only thing is, he hadn't heard of it until I told him I was going.
Yeah.
You know, I'll go be at the gym on Thursday because I'm going for my aneurysm test. What's that for? I said, everybody gets it. I never got it. You know, and I thought, I think that is a lot of people missing out. I think he did move house. And I think his letters sitting.
The dress,
Probably. And you mentioned your brother went for a scan and didn't have an aneurysm. Is there anything you tell people about relatives and the family connection, genetic connection?
Yeah, so if you have an aneurysm, then we do advise that any brothers and sisters get screened. There is a family, there is a chance that you've got a higher increase, a higher risk of having an aneurysm if somebody else in your family has.
So this is, they wouldn't do this until they're 65, or would they?
No, it's an age-related condition, so it tends not to develop until you're older. So we don't advise anyone to do it till they're a bit older. And we don't routinely screen women, but if you did have a sister, say to her to go to a GP, tell them about their past medical history, and they would probably arrange to have a scan.
Good.
So you're still in surveillance, a scan every 3 months, and things haven't changed, you said, for the past quite a long time
9
now.
months.
What is your feelings that, I know it's hard to say because it's not happened yet, but what if your aneurysm gets to the point where you need to think about an operation?
Well, I'm going to cry.
I'm sorry.
No, it's me. Because I'm not the bravest guy in the world, you know. But I would just go. You know, I don't have a choice. There is no choice. You know, but...
You had a friend that had his fixed, didn't you?
No, can you not remember? We were up on the ward one day, and I was in visiting, and the guy across us had just had his done.
Ah.
And you came in to see him.
That's right.
This was going back a few years, and he said to me, "Don't worry, it's easy." So I actually came home feeling fine that day. I forgot about that.
Yeah, no, I remembered it.
I remember that. He was no problem. And you were in telling him what to do the next few days. He was getting out.
That's right.
But I think that's a really good point and highlights how valuable it is to know people with this condition as well. Do you know of any patient groups, or are there any support groups out there?
No, it's funny. My wife's friend's husband's just been diagnosed with one. Now, he went in for something else and they got a scanner and it showed up. It's quite small. But he's the only other person that I know. But then it's no, I didn't talk about it a lot. I've got an aneurysm, you know. My wife tends to worry more than I do. You know, we can't book a holiday here because your aneurysm test's coming up. You know, and I'm like, let's see where, you know, if I miss it a week, I don't think it's going to be, no, she won't move.
Interesting.
She won't move until I'm checked. And so she works the holidays out saying, right, you're due one in January the 13th. So we'll book a holiday, you know, after that, it being okay. But we can't take a 3-month holiday because your next one's due.
Okay. So it's very important to your family that this happens
Yes.
on time
On time.
and nobody forgets
No
about
missing.
it. No
Yeah.
missing. Only a couple more questions. How do you feel about having an aneurysm? You said yourself you felt fine when you went to that first scan. You still feel fine, but there's something in there that's keeping an eye
You
on.
know, what can you do? As my young brother, other brother, this is another brother, he said to me, we're okay, Jim, but we don't know what's going on inside. But he's a wee bit of hypochondriac, you know, he really is. But as I said, there's nothing. I don't feel any different. It doesn't change my life whatsoever. And if the operation needs to get done, it needs to get done. And I know I'll be in safe hands.
We'll give you a wee moment. So Lorna, you've been an aneurysm nurse practitioner and doing scans for a long time, so you must get to know your patients well.
Yeah, I do. If they're coming for a long period for screening, we do get to know each other quite well. And I think that helps with anxiety and things. You know, Jim knows he can always ask any questions whenever he comes. Also we can keep repeating the advice, you know, that if there is advice on smoking or weight loss or whatever, we can reiterate that as we go along as well. And then, you know, if it ever came time for him to have an operation, then hopefully he would be in the best place for that.
Any final words of advice for people who might be coming up to their scan or who've just started? Anything you want to tell other patients?
First thing is don't worry. Don't worry, because you're in good hands. As the other one said, they're not there to annoy you, and hopefully you'll be fine. But if you're not, it could take years. In my case, 9 years, still doing. In fact, I'm doing okay. I'm doing really okay. So I would say, go get it done. Don't dilly-dally. Go get it done.
Fantastic. Thank you both so much. That's been so helpful. A great insight. Thank you so much, Jim.